The Cumberland Initiative has been trying to understand the challenges that are faced by innovators who wish to change the world of hospital and the built environment. We've been visiting the Hospital Innovations Exhibition and Conference 2016 and talking to exhibitors and other people about their world of data and knowledge. One of the challenges is that there are so many systems, services, products that will produce unbelievable amounts of data, and yet there's no real way to harness it and turn it into a better product or a better patient experience. Here are a couple of perspectives.
The patient would press an orange call, make a call in the system. The call is then sent wirelessly to the display panel at the nurse's base and displays exactly where the call is coming from and where they should go and respond to. As a member of staff, I can then, at the panel, accept the call. If there's any patient records or information, we can bring up patient record information. So when I respond to the room, I know exactly what to do with that particular patient. We can list every single call in the system in a simple Excel form, telling you exactly where the call came from, the type of call that was actually raised, the time that it was made, and the time that we actually got there. And we can also see on here which member of staff actually responded to it. I think we provide and have been providing this for a number of years now, lots of rich data, but the problem is that when they collate this data, it's the staff in the ward that's actually seeing the data. The staff in the ward are not the people who are going to make decisions on changing the care. It needs to go further along the line, it needs to go higher up the chain, but we don't see them utilising that. We don't see them really taking a hold of it and seeing what the potentials are. We can give them so much more, they just have to ask for it, and no one seems to be asking the question.
I think there's a lot of data, but how that's then translated into meaningful information that a health system can look at to evaluate what options might be available to them. I think that's an issue for us. I think we're a bit data-rich, information poor, so it's how we interpret it and can visualise it as well. Because just a ream of spreadsheets or a graph showing the relentless increases in activity over time aren't really enormously helpful without understanding what goes on in the dynamic of the system below that.
So here's the situation we find ourselves in. Lots and lots of data, drowning in data, really unable to harness it or to turn it into a useful way of delivering better care or a better experience for the patients that are coming along. Here's one of our affiliates from the Cumberland Initiative discussing how that data can be turned into knowledge and perhaps one day a little bit of wisdom too.
We at i5 have developed algorithms that can look at the patient records to see if there's a probability of the patient having an undiagnosed long-term condition. So if a patient gets admitted to hospital because of a broken arm or because of a respiratory problem, we might be able to identify if the patient has a cardiology-related problem like arterial fibrillation, which our codes could pick up. When I speak to analysts in a hospital setting who know the data quality isn't perfect, they would always strive first to improve data quality instead of start using the information. And this in itself is a hurdle which is a more of a cultural hurdle than a technology hurdle.